All right, how's it going, guys? Welcome back to Engineering Major Philosophy Minor. EMPM, as you guys know, is the channel where you can get a working aerospace engineer, me, my opinions on topics pertaining to engineering, philosophy, politics, and various other social issues. I am back from my business trip. I hope you guys enjoyed the little excerpt from the Gulag Archipelago that I read in my last video. And of course, on my way back from my business trip, I read a bunch more of the book. And of course, I read more before I go to bed every night. And I have a part two to that I want to make coming up here pretty soon. But as you can see, my hair is a little bit messy right now. And that's because I was about to go to bed. But then I was looking at something that I thought was interesting earlier today, and I decided I wanted to make a quick video about it. It has to do with coronavirus statistics, and Sweden has recently, this was a couple weeks ago, but recently they changed kind of their position on how they were going to handle it. And of course, me being a data nerd, I was looking at the data and I had some questions. So let me take you guys through what my kind of routine is, so to speak, when I'm looking at coronavirus data. The very first thing that I look up when I look up coronavirus data is I look at New York. Now, the reason I look at New York is because I think New York is actually an interesting population study of how the virus has moved through a population relatively rapidly. Very unfortunately resulted in the deaths of many people, but then kind of bottomed out for a while, and now, of course, we're seeing another big spike in cases. But my hypothesis was that the spike in deaths would not be nearly as high because the virus has, again, sadly, but surely consumed most of the lives that it was going to consume. And we can kind of see that here. Back in April timeframe, they were seeing like 10,000 cases a day. And now New York is again seeing around 10,000 cases a day. But if we look at deaths, we see that there was this huge spike back when it began. And of course, the slope of this was very rapidly increasing along with the slope of the case curve. Deaths peaked, the cases continued to go up, deaths started to go down. Of course, cases were still kind of not increasing, but still very high at this point. And then, of course, the virus consumed the life that it was going to consume, and then the cases died down as a result. And now cases are back up again. Of course, a significant slope increase in cases, similar to what was seen in early April and May, yet the deaths are not increasing at nearly the rate, and they're not seeing kind of nearly the same amount of death as New York was seeing at a similar time after the increase in cases, like back in April. So what I do is I look at New York, and then typically what I do is I go over to Sweden. Now, why do I go over to Sweden? Well, because New York was a state that implemented some of the most restrictive lockdowns, and as you can see, those lockdowns probably were not as effective as they wanted to be. Unfortunately, maybe they were a little bit too late. However, New York seems to have borne the brunt of this back in early April, and it is yet to be seen whether or not the deaths will spike to the same level eventually, but I kind of doubt it considering the caseload is already starting to level off, but the deaths have not increased. So then you have Sweden, which is a country that didn't lock down nearly at all practically. All the restrictions were voluntary, businesses were not shut down, etc. So I go over to Sweden and I take a look. And over the past couple weeks, I noticed something funny, which is that the data looks sort of bizarre here. It doesn't look, it doesn't look the same as it did in the beginning. I mean, it has this oscillatory type behavior, but here we see it actually going down to zero for many days at a time and then spiking up. Go over to deaths, and you see the same thing. You do see kind of a cyclical behavior. Typically, this has to do with weekend reporting and things like that. And they had a similar situation to New York where cases and deaths kind of spiked in the beginning, and then they tapered off slowly throughout the summer. But now we look at the deaths now, And in contrast to New York, where New York is not seeing nearly as many deaths as they were in the beginning of the pandemic, we see that it seems like Sweden is starting to see far more deaths than they were here, except that there's this weird behavior where for multiple days in a row, it's at 0 and then it spikes, 0 and then it spikes. So I went ahead and followed this link and I was like, why does the data look different? It seems like it changed. Well, as it turns out, it did. So if you click on this link, it will take you here. Data repository by Center for Systems Science and Engineering at Johns Hopkins. Now this is a different source than previously. So I started to do some searching, came across this Our World in Data. This is actually a really nice site. They present data in a number of ways, and you can make graphs yourself on this site. But here, the article or whatever, why do COVID-19 deaths in Sweden always appear to decrease in the last 10 days? Now, that's not really the phenomenon that I'm talking about, but listen to what it says here. In the data that we present on Our World in Data, which comes directly from the European CDC, deaths in Sweden are shown by date of death, while deaths in other countries are shown by date of report. This matters because it takes a number of days until all deaths for a particular day are reported. In practice, this means that Sweden might today only report 10 deaths for yesterday, but once reporting is complete, the death count for that day might increase to 40. The death counts for the last 10 days in Sweden should therefore always be interpreted as an incomplete count of the deaths that occurred in that period. So what it seems is happening is, and let me read this note right here. As of November 30th, due to our switch to Johns Hopkins University as our main data source for COVID-19 cases and deaths, the contents of this post no longer apply to the data presented on Our World in Data. Unlike our previous source, the European CDC, Johns Hopkins University collects and publishes COVID-19 deaths in Sweden by date of report. The analysis below, however, remains relevant for people who look at the official Swedish government dashboard, which we'll look at in a second, where deaths are presented by date of death. So, in sum, basically, this number right here is not, if I understood this correctly, and I may not have, but this is what it looks like. So, if, for example, I look at this 96 deaths on November 18th, this is not only counting the deaths that occurred on November 18th, but also the deaths that occurred on the 14th, the 15th, and the 16th, and maybe even the 17th, all lumped into one day. Now, the question I had is, well, why would you change that? Because let's compare this curve to the actual Sweden website. So if you go here and you click on the official Swedish government dashboard, it takes you here. Now, of course, a lot of this is in Swedish. I have put this through Google Translate. You can also put it through Google Translate yourself if you don't believe me. So this word means cases. This word is females, and this is men. This is intensive care, and this is it's not death directly. I can't remember what the other word is, but this is basically deaths. So if you look at their cases, you can see there's this huge increase in cases. Now look at their hospitalizations. Their hospitalizations actually aren't as high as they were in the April timeframe. And look at the deaths. The deaths per day are actually not as high as they were at the beginning. Now what's really cool about the Swedish website is this means, for example, cases per day, intensive per day, deaths per day, but we can switch this over to cumulative. So this is basically a running sum of how many cases there are, running sum of hospitalizations, and a running sum of deaths. Now, the reason why this is very important is because now we can look at relative rates of increases. So if you guys know anything about calculus, you'd know that a lower sloped line closer to flat is a lower rate of increase, and a higher sloped line or higher slope along a curve is a higher rate of increase. So we can see that the rate of increase in cases looks relatively linear in this time period, right here, but the increase in deaths is actually logarithmic, starting off somewhat exponential and then tapering off here. Now look at the slope of the increase in cases now. Significantly higher slope, yet lower slope in death. So what this means is that the Swedish situation is likely very similar to New York, in that the brunt of the deaths occurred at the beginning, and now more people are getting the virus, probably because it's very cold and everybody has to stay inside, but the number of people who are at severe risk for death have tragically already died, and therefore that's kind of why you don't see a huge jump and a huge slope increase in the number of deaths, despite the fact that there's a much higher slope in number of cases. And of course, similarly for hospitalizations, of course, we've gotten better at treating the coronavirus, and now we have a vaccine coming out. So that led me to the question of why did Sweden even reconsider its lockdown orders? So let's take a look at one of these press releases from Sweden. The government has decided that as a general rule, it is now prohibited to organize public gatherings and events with more than 8 participants. The aim is to counter the spread of COVID-19. Quote, these are very intrusive measures that are unprecedented in modern times. We don't take limiting people's right to assemble for gatherings and events lightly, but considering the situation we currently find ourselves in, it's necessary. We must reduce the spread of infection in order to support healthcare and save lives, says this Minister of Home Affairs, Michael Damberg. Now, we hear this very similar rhetoric in particularly Democrat states in the United States, and they always say, we need to support the healthcare system. Well, let's take California as an example. I thought that the whole reason of locking down in the first place was to increase the ICU capacity, increase hospital capability, etc., while we were in lockdown, so that we wouldn't have to lock down again. And then what happened was we opened up very slightly for a little bit and then had to lock down, and now have to lock down more restrictively. Now, how come the hospital system isn't ready to handle it, right? Now, there's so many things that, I can just think of off the top of my head that should allow us to increase our hospital capacity without having to lock down. One would be, why don't you send the military ship back to LA, right? Why don't we set up temporary facilities, outside of hospitals and in parking lots and stuff like that? I mean, surely it's not going to be super luxurious, obviously, but we can do that. And then the other thing is that, the hospital system might get overwhelmed. It might not, but it could. And my response to that is, and this is going to sound like I'm trying to be really cold-hearted and negligent and stuff, but I really don't mean it in this way. I mean it in the sense that there are smart measures we can take outside of lockdowns to just do the best that we can. But let's say the hospital system does get overwhelmed. Sometimes life is hard, okay? The reason why I was so optimistic about Sweden is because they were not going to, because I thought that they were not just going to go along with the rest of the world, and they were going to accept the fact that sometimes life is hard, sometimes there are things that come around that you can't stop, and you simply must do the best you can to, be smart about things, prepare yourself for the worst, and then live life. If you look at their data here, look, this is deaths per age group. Look at where all the deaths are. So then then look at where the most of the cases are, which means that the death rate for younger people is significantly lower than the mortality rate for these people. And we see this data across the board on this channel. You've seen when we look at the San Diego data, it's the same way. So why does anyone age basically 60 and below have to follow this 8-person mandate? And by the way, why 8 people? Why not 4? This is the problem, is that when you start restricting people's freedoms, something as simple as limiting gatherings um, is actually a really complicated thing to do, right? There's all these sub rules and there's possible loopholes, and then you have to control for all of that. And what ends up happening is that the bureaucracy and the enforcement of all these things ends up limiting so much more than the original thing that you wanted to limit. Anyway, I don't really know why Sweden decided to reverse their decision on this. You might say, well, Alex, there's seasonal increases in the intensive care, and then that plus coronavirus, makes it brutal. I mean, okay, that's a fair argument, but at the same time, my counter argument is, sometimes life is hard. You know, sometimes the hospital system is going to get overwhelmed, and you just are going to have to take it day by day and figure it out. This is not to minimize the difficulty that families have had, the tragedy of losing loved ones. And some of you guys might say, well, Alex, if it was your parents, if it was somebody you really loved, really close to you, then maybe you'd think differently. And if it was somebody really close to me, who passed away, um, or who was in the intensive care, I was very scared that they were going to pass away. Yeah, it would be scary. It would be absolutely devastating. If I was to lose my parents, the day that I lose either one of my parents is going to be the absolute worst day of my life. And then the next one to go is going to be the worst day of my life, right? It's going to be horrible. It's going to be terrible, right? I will be sad for a long time. I probably won't talk to anybody for a very long time. Like, it'll be awful. But life has to go on at some point. I am not about to try and restrict the freedoms of, 299 million, 999,998 other people, just because I'm scared of something that might kill my parents, which they actually have a decent chance of surviving, since they don't have any like horrible pre-existing conditions, like a lot of the ones we see make people very vulnerable to this particular disease. Anyway, guys, that said, I just wanted to make this video because I'm super disappointed in Sweden. I was really hoping that they could be a beacon of fortitude and courage, against this, with respect to the rest of the world. And unfortunately, now there's only a handful of states in the U.S. that are really taking what I think is the bold and brave approach, and accepting the fact that it's probably true that we're all going to get this at some point. Luckily, we have a vaccine now, so we can probably do a more diligent job at preventing deaths. But before that, I personally, my personal opinion was you weren't ever going to stop it. You might be able to slow it for a little bit, but the total cumulative number of deaths was never going to go down no matter what you did. There's too many interactions that can spread the virus, and there's no possible way to regulate all of them. And if you regulate one, there's a dozen others, you know touching this, touching that, talking to the wrong person. Like, so you might as well just understand what the risks are at an individual level, understand what puts you at most risk, what behaviors to avoid, what behaviors to practice to keep yourself a little more safe, hand washing, social distancing, mask wearing when appropriate. To be honest, like, I don't entirely agree with the whole mask mandate thing, but I agree with the fact that businesses should be allowed to enforce rules when on the premises of their own business. But in terms of just in public generally, it opens the potential for mask misuse, which can inadvertently put certain people at more risk because, not because they're intentionally trying to hurt people or intentionally trying to hurt themselves, but just simply because having to be, diligent with your mask is not an easy accomplishment. Anyway, guys, video is turning out longer than I expected. As always, leave a comment, leave a like, subscribe, and yeah, I'm really excited to get to you guys about this next part in the Gulag Archipelago because it's very interesting. I'll just leave it at that. So have a good night, guys. Thanks for watching, and peace out.